All right, welcome all to the Brain Health and Wellness Initiative series. Tonight, our presenter is Carol Klingler, and she is presenting on Can Dementia Be Prevented? Understanding the Risks. My name is Hannah Doles, and along with my colleagues, Nicole Hale and Cassandra Fazekas, we provide care navigation and the JFSA Dementia Care Navigation Program. Our program establishes an empowering environment to help improve the quality of life of those who have dementia or at risk of developing dementia, while helping family caregivers reduce the stress and burden that often occurs while caregiving.
Hi, I'm Cassie. At JFSA, we understand the importance in working with our clients' strengths and applying a person-centered approach to care, which extends throughout our multidisciplinary team of geriatricians, nurses, social workers, and geriatric psychiatrists. Nicole, Hannah, and I meet our clients where they are at and develop individualized care plans to help produce solutions to presenting problems, from linking persons with dementia and their families with community resources to following them with their medical management. We are their point of contact for guidance as well as a listening ear. We consider the intersectionality of one's life when creating interventions that adhere to their biopsychosocial needs and experiences.
Thank you, Cassie. We just want to go over a couple things before Carol gets started today. Thank you. We will take questions and answers, or we will take questions, excuse me. So look for the Q&A button on your screen, and you can send questions through that box. Please try not to use the chat button, please. Next slide. Thank you. We are also offering continuing education credits for this class today. So we will get a survey about a week after our presentation, and it will take about 30 days from the date of your application on the survey to issue your CE credit. We will email you the certificate at your email address that you used during registration. And if you can please try to use the email address that you use to access the webinar, that way we will know it's you and who to send it to. But if you do have any questions about that, you're welcome to contact us and we'll make sure you get your credit. Please also note that we cannot offer continuing education for group viewing. Next slide, please. A little bit about our speaker tonight. Carol Klingler is the founder and CEO of Life, a dementia-friendly foundation, a not-for-profit grassroots outreach program which offers 6 memory cafes that meet weekly in 4-hour increments. 2024 marks Life's 8th year of providing support to people with dementia and their care partners at no cost to them. Carol earned a Bachelor of Science in Nursing degree from Indiana Wesleyan University. She spent years as an ICU nurse and served as the Director of Nursing for Kendall at Oberlin, a continuing care retirement community. She also served as an adjunct faculty member for Lorain County Community College Allied Health and Nursing Program, and was a team leader and community facility coordinator for hospice and palliative care at the Hospice of the Western Reserve. Carol became a validation therapist in 1996 and a certified dementia practitioner in 2016. She studied techniques and gained knowledge and understanding of successful interventions for people living with dementia through course completion with Naomi Feil and Tipo Snow. Carol is one of our 4 master trainers for Dementia Friends Ohio as well. Carol is a former board member for Leadership Lorain County, the Person-Centered Care Coalition, and Lorain County Office on Aging. Currently, she serves on Thrive, a United Way initiative, and the Lorain County Joint Vocational Advisory Council for Allied Health students. Carol, we're very happy to have you here with us. It's your first presentation with us tonight, and thank you for joining our team.
Well, thank you so much for having me, and I'm so excited to talk about this topic. So I was just going to go over the objectives to start, that participants will have a general understanding of the of at least 3 types of dementia. And we'll be able to identify risk factors related to dementia. And we'll learn 3 interventions to decrease the chance of developing dementia. So, I know most of you probably know the answer, what is dementia, but I'm still surprised when I work at our memory cafes, the people that come in and say, well, what's the difference in dementia and Alzheimer's? Or my husband has dementia, but it's not Alzheimer's yet. That's another thing I hear. Or they just tell me they have dementia, but they don't know that there's a type. And I like to relate the term dementia as we would the term cancer. If I said someone had cancer, the next question would be what type? So we should always know what type of dementia someone has. So there are multiple types of dementia. If you actually Googled how many types of dementia, some sources even say there are up to 200 types of dementia. But dementia is the syndrome, it's the signs and symptoms that we see that lead us to that diagnosis of the type of dementia. And it's important to know the type of dementia because we want to know if there's an underlying cause. Is there something that's going on that might be treatable? And are there treatment options for the type of dementia? Also, management strategies, how things we can do to support the person living with dementia and the care partner. We want to have better planning, supports, and interventions available if we know the course that this type of dementia normally takes. And be able to make informed decisions. And a lot of times early diagnosis of the person can still make decisions for themselves. And so we want to make sure that we're living out their wishes. And also, how can we have preventative measures for certain types of dementia? Because maybe not all types of dementia can be prevented, but there's a lot of things we can do to improve our chances. And there are several different types of dementing illnesses that have been diagnosed, like I said, up to 200 different reasons. They differ in their clinical presentations. A lot of times early on, there's 10 common signs of dementia, but throughout the course, we'll see differences in how they present. And then post-mortem histological changes seen in the brain give us a clear idea of the type of dementia. Recognition is important again because of the treatment, prognosis, the course of the disease, and the behavioral issues that tend to differ. Understanding the cause of dementia is crucial in seeking those preventative measures for your family members or even for the person living with dementia. There's things we can do to help slow the progression. So just a few types of dementia. I said there could be over 200, but vascular dementia, most of us know it's caused by reduced blood flow to the brain, often due to a stroke or small vessel disease, where Alzheimer's disease is different in that it's a progressive neurological disorder. And then traumatic brain injury is another form of dementia that could be caused by a blow to the head or trauma to the head. So football players, hockey players, obviously we know there's preventative measures there that we could be doing, automobile accident, etc., that could cause that type of dementia. And then normal pressure hydrocephalus, which is the buildup of the fluid in the cavities in the brain known as the ventricles. And it can result in problems that appear as regular dementia, but also usually are progressive quickly if you don't have the shunt put in to care for that type. But there's things we can do differently for each type. So preventative measures, there's no guarantee, of course, that we can prevent dementia. We wish there was, but there's certain lifestyle choices that can help us reduce the chances of developing the cognitive decline. And these are just some of those choices. Exercise, of course, having a healthy diet, cognitive stimulation, social engagement, and managing cardiovascular risks. And I'm going to talk a bit about each of these. So regular exercise, the way it can help prevent dementia is it improves that blood flow, as we talked about vascular, ensuring the brain receives those adequate nutrients and oxygen. It promotes neuroplasticity, which stimulates the brain's ability to adapt and form new connections. It enhances mood and reduces stress, so it's releasing those good endorphins that make us feel good and have a feeling of well-being. And it aids in neuroprotection, reducing the risk of neurodegenerative disease, such as Alzheimer's type dementia. So we do say what's good for the heart is good for the brain, and exercise helps manage conditions like high blood pressure, diabetes, obesity, and it improves spatial awareness. So I'm really interested in how spatial awareness allows us to be conscious of the things in our environment as well as our own position relative to them. And I'm going to talk some about spatial awareness because I think it's a unique thing to consider as we're doing things to prevent dementia. So some of the ways we can increase our spatial awareness as adults is taking up certain hobbies like photography and drawing, trying certain video games. So there's older studies that show that Tetris improves spatial skills in older adolescents, and taking time to play. So children, a lot of times, they have a greater spatial awareness of where they are in time and space. That's why they can run through the house and not trip over anything. They seem very agile. And it's good to have that as a younger child and build on that as we grow older, but we can still do things as we're older, like working on puzzles, trying the visual memory games, and just staying active. So if any of you have exercised, for example, you start becoming more aware of where your right arm actually is and your left leg, you're just more aware. If you're following along with someone and you're exercising, you have a better awareness of where you are in time and space, and that's your spatial awareness. And the brain changes that occur with dementia affect how we see, hear, taste, touch, and smell, but also how we see, hear, taste, touch, and smell will affect how we receive and share information with other people. And so we know that taking care of our senses can also reduce our chances or improve our abilities in working with someone with dementia, improve our chances of avoiding dementia. So for example, if you had visual issues, you want to have your glasses checked, contacts, whatever. Hearing aids, you've probably heard many times about people with poor hearing having an increased chance of dementia. So if you're not taking in information properly and you're not understanding what's being said, one of the things that I think happens to people is when they don't understand, they quit asking questions, they quit engaging because they don't want people to get upset that, they say, well, I already told you, or you're not listening, something like that. So they just quit participating. So they start withdrawing. And then having good oral care and proper fitting dentures is another thing that we can do to help fight off dementia. So research has found that people at high risk of dementia who followed a healthy lifestyle lowered their risk of cognitive decline. They ate a diet which included fish, fruits, vegetables, and oils. And many of you have probably heard of the Mediterranean diet, which is rich in the produce, whole grains, nuts, seeds, and people have been shown to have better cognitive function that had this type of a diet. Another thing is avoiding alcohol. So some people say, well, a glass of wine is good for your cardiovascular system, which maybe it is, but I've never seen any studies that actually say that alcohol itself is good for the brain. So my research is saying large amounts of alcohol because nobody wants to be told not to drink alcohol, but I've not seen anything that says alcohol is good for the brain. But drinking large amounts of alcohol has been known, of course, to cause brain changes that are not reversible. So we have alcohol and drug-induced types of dementia. There's been several large studies and reviews that found that alcohol use disorders were linked to an increased risk of dementia, particularly early onset dementia. So a lot of times that's a factor that could be reversed. Also, keeping our mind active, having that cognitive stimulation is key, not only to prevent dementia, but also if you were diagnosed with a type of dementia, you want to still keep your mind as active. There is truth to the use it or lose it type of ideal. So mentally stimulating activities might delay the onset of dementia and decrease its effect. So spending time reading, solving puzzles, and playing word games are some examples. Reading out loud and doing simple math quickly stimulates more areas of the brain. So I actually had found this very interesting study where they looked at people just doing simple reflection, meditation, prayer. They didn't light up the areas of the brain during an MRI as much as when they did simple math quickly or read out loud. And the same in doing complex math. So if they were doing complex math, their brain didn't trigger as many areas as it did doing simple math quickly. So some of the things we do at our memory cafes, we have flashcards out, or we encourage people to read out loud. And we call it waking up our brain because it just fires more areas of the brain and keeps the brain more active. Which leads me to the topic of cognitive reserve. I don't know if any of you have heard of the term cognitive reserve, but you can think of cognitive reserve as your brain's ability to improvise and find alternative ways of getting a job done. So being able to do complex types of activities. It reflects how agile your brain is in pulling in skills and capacities to solve problems and cope with challenges. What happened was the concept of cognitive reserve was found in the 1980s when researchers described people during an autopsy that had no apparent symptoms of dementia or Alzheimer's disease show brain changes consistent with the plaques and tangles of Alzheimer's disease, but they didn't have any symptoms, and yet it looked like they had full-blown Alzheimer's disease during that autopsy. So cognitive reserve was credited toward their brain was able to function in areas where and we've seen people also that have had strokes and had brain affected do better than someone else with a same type of stroke that affected the same area of the brain. So we think there's other areas of the brain that start compensating. And we can do things to improve that. Usually we build our cognitive reserve in childhood the most. And this is at the time where it provides a person with a greater number of neurons, more synapses, neural connections, and multiple pathways to perform any tasks, such as this reserve. It comes in handy when a person is faced with the effects of brain aging. But there's things we can do even now, even if we didn't build a good reserve early, we can still do things. We do see that people a lot of times that are higher educated, but that work in more complex occupations are more apt to have a higher level of cognitive reserve. So being exposed to mental activities, again, reading out loud, I'll say, again, out loud, playing board games and that are strategy type games, and regular physical exercise also helps a lot. So some other things we could do is take a new route, or one of the things I really noticed is that we become dependent on our navigation systems, including me. I would drive a lot of times to Cleveland and I would use my navigation system from Lorain County to Cleveland, even though I knew where I was going. And I would realize that I would not know where I was all of a sudden. I would look and say, oh, wait, where am I? You know, I'm not paying attention. And I think we lose some of that cognitive reserve when we're not paying attention to where we are, that spatial relationship in time and space. And so learning a new route, going one direction somewhere, coming home another, it's not bad to have the navigation system as a backup, but don't use it as all the, you know, something you're dependent on all the time. Start paying attention. Where am I going? How do I get back? Is there a different route I could take? Learning a new language is another thing that stimulates other areas of the brain and gets the brain working in different ways. the use of the opposite side of your body. So something as simple as making a peace sign with one hand and an okay sign with the other, and then switching and changing okay and peace, and trying to rapidly do that can also stimulate more areas of the brain, or using the opposite side simultaneously. So I actually mixed those up. That was that part. The one before that, using the opposite side of your body, could be just writing with your non-dominant hand. And then the opposite side simultaneously would be doing the peace sign and the okay. And then being curious, exploring things, trying to understand something different, especially complex tasks. So you want to try to use your ability to understand things that are more complex. And so complex would be things that are of more than one facet. And trying new things, especially if it's something maybe you weren't interested before. Maybe you always like to bake and cook, and you could take a class on baking and cooking, but that's not going to be the same as if you've never gardened and you took a class on gardening. Because now you're going to learn new things. It's going to be something complex, and you're going to try to build that cognitive reserve. Also, social engagement is associated with reduced rates of disability and mortality, and may also reduce the risk of depression. So we know depression can impact dementia as well, or bring on dementia sooner, or give symptoms that are related to dementia. And being socially engaged is very important to have that connection and that sense, again, of well-being. Remaining socially active may support brain health and possibly delay that onset of dementia. And there's many ways to be socially active in your community, and these activities will provide the greatest connection to other people. So some of the ways we can be socially active is joining clubs, volunteering, just doing things that make you feel good about what you're involved in. Volunteering in an animal shelter could be the thing. Selecting activities that you enjoy. Of course, if you enjoy that activity, you're more apt to engage and continue over the course of time in that activity. Also, managing our cardiovascular risk is really important, especially when it comes to vascular dementia. So we can make life changes that include stopping smoking, maintaining a good diet, exercising. If you have a family history of high blood pressure, hypertension, high cholesterol, type 2 diabetes, you want to be evaluated and make sure that you have these things under control, and that you reduce your risk of developing them if you haven't already. And also being aware of sleep disorders. We're learning more and more about how sleep or sleep disorders impact dementia. So a sleep disorder is any disruptive sleep pattern. It could be trouble falling asleep and staying asleep, which we know is insomnia, excessive daytime sleepiness, which is hypersomnia, difficulty breathing during sleep, apnea, or excessive nighttime physical activity such as restless leg syndrome can also impact our sleep, and so can pain in general that's uncontrolled. And then nocturnal hallucinations and our behavioral problems, which a lot of times can occur with people who do have early onset dementia. So some of the effects of sleep deprivation include irritability, cognitive impairment. And if anybody's ever gone a lengthy period of time and not been able to sleep, you know that's true, that you don't think is straight, or you have memory lapses or loss of judgment, poor judgment, severe yawning, hallucinations, I can go on and on, even increasing your risk of diabetes, decreased reaction time. So all of this is so important to maintain your health with good sleep. But there's also some new findings that we don't quite 100% understand. These are recent as 2015, where studies were done, and they found out that the Alzheimer's protein, the beta amyloid protein, it forms, like everybody does develop or makes beta amyloid protein in their brain. But this is the clumping and clusters that form our Alzheimer's plaque. And no one actually understands how this all functions or how beta amyloid functions for sure. But what they found is that when we sleep, our brain cells and their connections actually shrink. And I think of like an ebb and flow happening in our brain. And the shrinking allows more of the spaces between the brain cells so that the beta amyloid and other substances that accumulate during the day can be flushed away. And they thought this is probably happening during REM sleep, but found it actually happens right before the REM sleep. The other thing is inflammation has long been thought to be a side effect of some of the dementias, such as Alzheimer's. As the body ramps up its immune system to the response of the disease, they thought that inflammation was a response, but there's also some recent research that confirms inflammation actually contributes to the disease process. And one of the studies that I thought was very interesting is how they had looked at people using anti-inflammatory drugs for arthritis, and they actually had a lower incidence of Alzheimer's type dementia. This has also been backed up by larger genetic studies. So inflammation does play a role. Normally, the brain's inflammatory cells help to prevent damaging buildup of beta amyloid by clearing it away. And it's thought that mutations in inflammatory genes hamper this process. Inflation is a sign of the immune system kicking into gear. And in the initial stages of the disease, we thought this was beneficial. But we're also seeing that during Alzheimer's disease, when the disease becomes more advanced, chronic inflammation can set in and actually harm the brain. It's a toxic insult that the brain receives. So there's twofold right now. The brain's immune response to inflammation is believed to be partially protective, but also chronic and toxic. So inflammation is playing a role. Vitamins, there's a lot of things that we're hearing, vitamins are not helpful, but yet we know that vitamin D and sunlight are important, again, to have better sleep. Background sunlight exposure and high vitamin D status have been hypothesized to reduce the risk of developing dementia. And then having that natural light and exposure, again, like I said, can cause us to sleep better. So the vitamin itself might not be helping reduce the symptoms of dementia itself, but it has other benefits that do help prevent dementia. And I've had people say, I did all that. I always ate right. I did everything, and yet I still have developed dementia. But you are still also building a more resilient brain. And those changes that cause symptoms of dementia are going to be less dramatic and are more delayed compared to people with the same brain changes who don't have healthy habits in the 5 key areas, according to this study. So researchers found that having a higher lifestyle score based on a calculation from 5 lifestyle factors was linked to better overall cognitive functioning as a person aged. And the 5 things were things we just talked about: diet, physical activity, cognitive engagement, smoking status, and alcohol consumption. So people's cognitive function was measured using 19 tests that the people took regularly as part of the study, and the 19 scores were combined to provide an overall measurement of cognitive function. Research shows that exercise may slow down dementia symptoms such as thinking problems and ease anxiety or depression. Prioritizing good sleep. These are just things to focus on. Also, if you have someone you're living with that has dementia, these things can also be helpful for them. Working on being aware of what they eat can help them, and challenging their brain might mean revisiting a hobby the person has always loved and is still able to do. Also, enjoying music. Music is so powerful because it validates our feelings. It helps us to reminisce. It gives us releases us the good endorphins. And some people can still play instruments, playing the piano or going to services if they had longtime place of worship. And also, people a lot of times that don't talk much will engage in singing, because singing lives in a different part of the brain where emotions are stored, and so that can also delay some of the symptoms with dementia. And staying organized, having a routine and familiarity can be very important. And it's for people with good cognitive health, like I said earlier, doing that complex activities is beneficial, but for someone that's starting in the stages of dementia, a lot of that organization and routine is important to just keep their day in and day out familiar routine. But you can add in special days, like when people come to our memory cafe, they can do complex activities during that time. It's part of their routine to go and do something different. So I hope that makes sense. And also, just feelings do matter. You know, a lot of times people tell us feelings don't matter, but the more I work with people living with dementia, I realize feelings do matter. And that means our feelings too. If we're always feeling frustrated and angry, we're not doing good things for our brain. People with memory loss and dementia often lose the ability to do the complex thinking. And again, it's doing more than one thing at a time. But that could even be something simple to us, like putting a load of clothes in the washer. You know, there's several processes to that makes it a complex task. Task-focused activities are difficult, but emotional and feeling-based activities are meaningful. And they are to us too. That's why I said, like, volunteer at the, at the local pet shelter, or something like that. If that's something you enjoy, that emotion that you get with it is good for your brain as well as it is for your overall feeling of well-being. And then my own personal experience, when I started in nursing, I actually worked in the ICU, and I would have athletic men come in their 50s needing open heart surgery, and they were just so shocked that they had to have open heart surgery because they were athletic and they ate well and they did all the things they were supposed to do, and yet here they had heart blockage. And what they didn't see is how well they fared compared to the sedentary people that were their age or in that range, that you could see a dramatic difference on how fast they healed and how well they did. And I do feel the same thing with the people that we see at the Memory Cafe. People that stay engaged and socially involved and try new things, they fare better than the people who sit home and become withdrawn and isolated and are not engaging. So basically, we know Alzheimer's cannot be reversed, it can only be prevented. And again, it can't be 100% prevented, but I do believe that with a lot of these steps that are in place, taking care of ourselves early on, staying engaged, staying active, socializing, there's so many things that we can do to help prevent Alzheimer's or other types of dementia. And so at this point, I'm ready for questions or comments.
Thank you so much, Carol. A lot of good information. So again, with your questions, please feel free to ask them through the Q&A button, and we'll take any questions you might have. Okay. You mentioned how the brain impacts your senses. How can you improve taste? My mother has had a change in appetite since developing dementia.
Yeah, that one of the things that is somewhat, I would say, normal, so to speak, is that the taste for sweet things tends to last longer. We do lose some of that. One thing can definitely be having good oral care. I don't know if she's, taking care of brushing her tongue, brushing her teeth, those types of things. A lot of times we don't think about brushing our tongues, but there are things that can help enhance the taste. We have a lot of things that, as far as like, things that are low carb, but sweet tasting still, that might be something that she'd be interested in. But I do know that a lot of times that is a problem with the sweet taste, but I would say to make sure that her oral care is at optimal. Also, always look at medications, because medications a lot of times can change the taste for people, and we think, well, they've been on that for a while, but I always say look at medications and make sure that that's not a side effect of the medication. If it is, talk to your physician about that.
It's a very good point you bring up all that. Someone asked, I've heard that aromatherapy and eating cinnamon can help with dementia prevention. Is there any truth here?
I think aromatherapy, there's certain types of aromatherapy that can reduce anxiety. It can make you sleep better, things like that, that can play a role in that. I don't really know about cinnamon. I've heard of cinnamon for like helping maintain a healthy weight. It helps with your regulating your blood sugar and that type of thing, which of course then again, it's another step in the right direction, because if you keep your blood sugar in check, you're less apt to have issues with damage to blood vessels and things like that. So I could see there could be benefit, but I don't know 100% that that's true.
Thank you. I know I've seen things too about turmeric being something
Yeah, I
like
saw that.
known for that. So I don't know if you
Well,
have
and that
tried
turmeric
anything on
has
that.
anti-inflammatory properties, I believe, is another
Oh,
thing. And I do think there's something that we are overlooking about inflammation. I really do. But that's my own personal opinion, not that of a doctor, but inflammation does play a role in our body. I mean, you can wake up one morning and your rings on your fingers can be tight. Well, what's going on with other things in your body? Is your brain affected? So I think inflammation for many other reasons as well could play a role.
mhm. Thank you.
Mhm.
What do you think of the current emphasis on early detection? Are there ethical implications?
Well, there are, I think, especially if you have a wrong diagnosis. We actually had a person that was early onset Alzheimer's diagnosis that is now being told, well, maybe that's not it. And it can be really frustrating for that individual, for one, as they're working up and doing more testing. But the benefit is having the control to plan things for the future. I think if you're a proactive person, and you are able to let your wishes be known, make some plans, get different things in order, but also get involved in things like exercising, getting your diet in check, and, start making positive changes in your life. If you drink or you smoke or whatever, make those changes. So there's benefits to it. There's always going to be ethical issues and concerns with things like that, but I don't know. I think I would want to know and plan, just like, there's a lot of genetic testing again for cancers. And it's like, you'd want to know, I think,
Yeah.
most people, but some don't.
Right.
So.
Right. That is true.
Mhm.
Someone, I think going back to eating habits we were talking about, do eating habits change? And I assume they're kind of just meeting what you can do early on to what are some of the things you would suggest in terms of focusing on for eating habits?
Well, I think it's gonna be, not having excessive sugar and the different, you're gonna eat more fruits, vegetables, less red meat, that type of thing, more fish. So if you look at the Mediterranean diet, that is the main recommended, there's some other ones out there too, but It's not supposed to be a diet as in diet to lose weight type diet. It's supposed to be a lifestyle change diet. This is the type of food I eat now. And, most of the dietitians I've talked to, they say, don't say you'll never have a bag of chips or you'll never have, a candy bar or something, but you're going to like have a piece of chocolate or a small bag of chips, not a big bag of chips, and you're going to eat them slow. You're going to slow it down and pay more attention to what you're actually taking in, but you're going to want to avoid high sugar processed foods, basically.
Can you comment on personality changes in the early stages of dementia?
Mhm. Well, that's an interesting thing because it is one of the top 10 things that, when people show signs of dementia, one of the things to look for is a personality change, which it isn't always a negative change. A lot of times it is. It might be a change where somebody doesn't remember things that you told them. For example, one lady was sharing with me that her mother had come to live with her after her father died. And everything was going along fine. And as time went on, things changed with mom, where suddenly mom was asking her, where have you been? And why haven't you been here? And you never told me that. And where's my stuff? And you moved my things. And started really accusing her of hiding things and lying to her and not being home. And she said, I suddenly realized I was my mother's caregiver. It wasn't something she had expected to have happen. It was something that happened and she found out because of these behaviors. She at first would, Mom, no, I was at work. I go to work and I don't get home till, no, I never knew that, But we also have seen people that were worriers. They worried all the time and they fretted over everything. The family's like, wow, she's so happy now. She just wasn't worrying anymore. And suddenly everybody's honey and sweetie and she's just happy. And so, but a lot of times personality changes are something that we do notice early on.
Is that something that you kind of discussed with the doctor early on? What would you recommend if you're starting to notice that with your loved one?
Yeah, I think it would be nice to, if you could talk to your doctor to actually document some of the things, so you're not just going in and trying to recall them at the moment of the appointment, because sometimes things don't go like you think they're gonna go in an appointment. If you have it written down when you go in, it'd be easier to focus on some key points, because the doctor has such a small amount of time and they get a snapshot of that person. And a lot of times they really feel that person's doing just fine, They know what day it is, they're not having any pain, they're not having any problems, and they move on.
Yeah. Thank you for that.
I do want to add one thing when you said too about the behavior is pain is a lot of times an issue that we don't recognize with dementia. And I really, really believe that I see it all the time that, we don't know. If we ask the person if they're having pain, a lot of times they'll say no because it's chronic. It's something they just have all the time. They don't even know they're having pain, but they'll show it in behaviors.
Mm-hmm.
So they're aggressive, they're frustrated, they're angry.
Oh. Carol, hold on just a second, everyone. I'm sure that Carol, her internet might be having an issue, so she'll come back with us, I'm sure, soon.
To ability to chew food still, to swallow appropriately, pocketing food, things like that can happen. Also, understanding how to use utensils could be a problem, so you might want to try more finger food type things somebody could pick up and eat and make it more convenient. And things that are attractive. A lot of times, there's things we can do to get hydration in and like give somebody a popsicle or something like that. They have a lot of the fruit ones now, but some of them are high in sugar. So, you just have to kind of balance out, I guess, what you're trying to accomplish versus the benefit risk type thing.
Okay, thank you. And someone else asked, can you comment on the use of artificial sweeteners with
Yeah, I
dementia?
mean, it can, I know there's long-term effects that can harm people, but I think a lot of times at the stage of the dementia, if that's all they want is the sweets, it might be better off to reduce the carbohydrates and use the artificial sweeteners, and the long-term effects aren't going to be an issue. So if they tolerate it well, that could be an option. I know we've done, we've had people that are actual diabetic dementia and they want candy bars, and the spouse will bring in like the Atkins bar or something that, is a lower carb alternative, and they're satisfied. They're happy with that. And some of it's the appearance, because it looks like a candy bar, so it works.
Thank you very much, Carol. I think we have time for one more question. But we do thank you for coming tonight, and it was very good information. And, I think everybody is interested in how they can prepare for the future, how they can, you know, they don't have to go down that road of developing dementia. I think everybody is very interested in that in today's society. So thank you so much for coming today.
Sure. Thank you for having me.
All right.
Did we
So,
do the question where it says, does it matter if you sleep, what time you sleep at night?
oh,
Like if you sleep from 11 PM to 6 AM or
oh,
1 AM to 8
good
Yeah,
AM?
question.
not that I'm aware of. There's nothing saying it matters on that time. It didn't state that at all in the study. It was that period of sleep that was right before the REM type sleep that this action was occurring with the beta amyloid and the flushing out of the chemicals and stuff.
All right. Thank you.
Thank you.
Well, we thank everybody for coming tonight as well. And we would like to just tell you a little bit about our dementia program. So Cassie, she may be a new face to those who come to our to our programs more regularly, but she's our new care navigator and dementia care coordinator for the Alzheimer's disease and dementia support program. So everybody give her a warm welcome. You'll be seeing her more on our presentations. Also with us is Nicole Hale, and of course myself. So thank you all for coming. We're here to help you in terms of our programming, and if you do know of somebody that has a memory issue or a family member that may have a diagnosis, we're here to get you connected to various resources within JFSA or the greater community that can just help you live a better life, and quality of life is our goal with our clients. Next slide, please. We do have 2 geriatricians that work with us in our Allison's Place clinic, Dr. Elizabeth O'Toole and Dr. Constance Magulius. They will see patients to do cognitive assessments, and they work really closely with Nicole, Cassie, and myself on suggestions for our clients and how we can keep them safe. Next slide, please. Pamela Lynch, she is our Caregiving with Confidence workshops facilitator. And of course, Carol Klingler, who you met today, she's with us now for our Brain Health and Wellness program series. Next slide, please.
And we do have additional resources, our Caregiving with Confidence workshops. They're 6 weeks, 2-hour online Zoom courses. They are very helpful. We have our dementia support group every second and fourth Tuesday from 1:30 to 2:30. And those you would register for ahead of time, we'd send a link. We have our Alzheimer's disease and dementia support program, supportive home care program, and then our brain health and wellness series with educational presentations. And then our next webinar will be how alcohol affects your brain function and dementia. And Dr. O'Toole will be presenting that one. And that will be on April 25th from 6:30 to 7:30.
Here's our contact information, so if you have any questions about today's presentation or any of the programs we talked about, please feel free to reach out. We hope to see you in April for our next presentation. Please also look out for the survey for the presentation tonight, and please sign up for your CEUs. So thank you all for being with us. Thank you, Carol and Cassie, and have a good evening.
Bye.
Thank
Thank you,
you.
Hannah.